Welcome to Doctors In. I'm gonna be your hostess for today, Dulia Hobby. Today we have with us Dr. Asma Munir. She is OB-GYN and IVF specialist, and now she is working at Conceive Gynae and Fertility Hospital. She has been a pioneer person of IVF in Saudi East Asia, and also she has been a member of international forums of OB-GYN and IVF. Dr. Asma, what are the services that you offer at Conceive?
It's a very simple but a very long answer to it. Conceive Gynae and Fertility Hospital is one of the old and senior hospitals in Sharjah, which is an assisted reproductive technology center. And services means the comfort of the patient for diagnosis of fertility, plus all the basic investigations are available there to get through. Plus then whatever the diagnosis is, the steps to conceive, starting from natural conception, helping them to naturally conceive, and then to advanced assisted reproductive technologies like ICSI and PGD. So if you go step by step, first is for natural pregnancy assistance, and then to assist in the intrauterine inseminations, then IVF, that is in vitro fertilization, then intracytoplasmic sperm injection for the specific reasons, long story behind, and then for pre-implantation genetic diagnosis, and latest technologies being embryoscopic examination of the growing embryo. That helps to identify lots of growing potential abnormalities so that we can select one best embryo to transfer. And some of these were not known before, so people were missing the diagnosis and missing the management as well. So going to the latest, but then we are in trouble when people want to do and they don't know what to do. So then it becomes the part of awareness programs that we come through.
What is the infertility and what are the causes, especially in UAE?
Infertility is the wrong word for me. I think it should be subfertility, because nobody can be labeled as infertile until and unless lots of diagnosis methodologies has been tested for. And if the conception is delayed after consumption of a normal married life of, some says 1 year, some say 1.5 years. The latest old books used to say 2 years. But I think it depends on individual when to come for treatment, because bases lie into the male and female background history, starting from the genetics onwards, because the subfertility being defined as inability to conceive with a known given period of time with full effort. But what are the reasons for them to be subfertile depends upon lots of things, starting from age, weight and lifestyle, and genetic code from the couple belonging to a family history of subfertility is there. So they should come early as possible to seek help. So the reasons of subfertility are multifactorial. It can start from mother to the whole family, and from the environment to pollution. You can, they cannot be limited. Anyways, the causes of infertility or subfertility, but if we go as male and female in general, so in last about 10 years of time, the drastic change has come that previously people used to think only female is the responsible person. But now it's equally male and female factors we are seeing every day. And it is increasing. The percentage is increasing in youngsters, and percentage is increasing in male gender as well. So lots need to be taught, lots need to be taken care of by all of us.
Yeah, but what's the reason that it's increasing every day?
It's the reason for me is the change in the lifestyle. Going back to nature is the key. And early recognition is the key of some genetic problems. That if you are having some endocrine disorder, previously, before marriage, you should consult. And for that, pre-marriage counseling should be there as a part and parcel of, puberty management once somebody is seeking for married life.
Yeah.
The reasons from the ovarian genetic problems, like uterine factors, if you want to exclude first, I would describe as male and female and in general.
Yeah.
In females, it can be the womb problems, that is uterine problems. It can be ovarian problem. It can be the tubal problems. It can be, other endocrine disorders which are playing a key role in the management of the cyclicity of a normal female. And apart from that, then comes the environmental effects on a body of a female or a male as well.
Yeah.
Lifestyle and bad dietary habits, weight, age. Higher is the age, declining is the fertility. Higher is the weight, lesser is the chances of pregnancy. And similarly, the thyroid dysfunctions are there. Similarly, the background genetic code is there, because if the mother had been struggling to conceive her baby, that baby might have the same genetic situations when she wants to become pregnant. So all these backgrounds, plus there are certain chemical poisoning into the food that we are eating. That's where eating habits are now getting more important.
Exactly.
That whatever we are eating is not what we should eat.
Yeah.
So what we have to eat, we don't like it. And similarly, we have converted our biological clock tremendously. The AM has been converted into PM. See, whatever the body used to train itself to deal with itself at a particular time of a day and night, we have changed it all together. So the diet plan, the habits, the psychology, the stresses of the society, the stresses of over a female, over a male, both is increasing. Now nobody is trying to get hold of the reason. They just want to jump in for pregnancy without getting the management of why they are not getting pregnant.
Exactly.
You see?
Yeah.
Most of us, when they come to the clinic, they are in a hurry so much, as if we have got a plate filled of babies and we just offer them, in a dinner dish. There was a joke initially when we started IVF back in Pakistan. There was a couple came, and I would share this with you so that people can learn how it was difficult for them to digest in vitro fertilization. There was a man who came in with 4 wives, because as you know, we have multiple marriages of all age groups. And this man, he came to the clinic and back in 17 years back, banged on the front desk. I want test tube baby to be put in all my wives. They didn't have the slightest idea what is a test tube baby. They thought there is a market and they will get the baby and they will put it inside the mother's womb. And then we digged out, and definitely there was an issue of the male that he was not unable to get the fatherhood. But this is what the concept was for IVF before. And most of the time in ethical and religious backgrounds, or they were thinking it's halal or haram. This was a great issue for ages.
Yeah.
And now, alhamdulillah, with the passage of time and increasing awareness, we are happily, at least people have gone through the internet, they come us with a lot of questions. It solves some of the issues, but also increases some.
Yeah.
Because little knowledge sometimes is more dangerous. So then, when you go for the reasoning of infertility, I think it would be better to start from the 8 weeks of pregnancy, because when the baby girl or boy is getting his first breath and the first recognition as a boy and a girl gender, from there the care should start. From there the care should start, so that the ongoing baby should be a fertile person when it comes into the world. First step. So who to teach them? Who is going to take that responsibility? I think it's a mutual responsibility on all of us, on the doctors, on the paramedics, on the social services.
Absolutely.
Everybody should, and especially at the puberty when they are changing. This is the most vulnerable area. Nobody's addressing that.
Exactly.
Especially girls and boys, they don't know what to do, because they think they're old enough to decide. And parents think they're grown enough to, already read everything. It's not right. We should keep an eye, but we should politely, humbly, friendly ways to deal with the growing girl or boy. And then also the weight consideration, the habits consideration, and if, for God's sake, if there's a problem when the baby is about to, reach the age of puberty, parents should take care, they should seek information and then management. Like, for example, ADHD, the polycystic ovarian disease, like families of diabetes, the strong families of diabetes, they should take care of their children now, so that when they grow, they should not have the same problem in them. And they will keep on increasing, because as the pollution and the environmental toxins are increasing, nobody can prevent all these things to happen.
When should couples seek medical advice?
There are quite a few factors before getting married. We can start from there, because if somebody wants to try to get married, if she or he has some problem before marriage, they should get it treated first of all before. Okay. Now, when they get married, already some of them, they know their problems, so they should go as soon as possible, because the time frame for passage of age and increasing fertility is there. So especially if somebody is trying to get pregnant at a later age and they have been married only for 6 months.
Yeah.
So that time frame doesn't fit in this definition, because if somebody is 35 and got married now, they should seek immediately if they don't conceive within 6 months. So depending upon the age, depending upon the background history, family history, and depending upon their endocrine balances and their own body responses towards the cyclicity, they should seek as early as possible. At least recognition of the problem should be there. What to say of management will come later. Because if they know, if they have polycystic disease, if they have endometriosis, if they have fibroid, just for the sake of information, they should go and check themselves up. And for men, I think this is the most easiest way to check them. Just a semen sample, easily given with a gap of 3 days of abstinence, and go and get themselves checked. So instead of checking that later and spoiling 4 lives in East and 2 lives in West. You understand what I'm talking about? Because not everybody is having an arranged marriage. So if there is an arranged marriage, there are families involved. Exactly. If the person is azoospermic, if the female doesn't have a uterus, or if having a long hypo situation is there, that means the pituitary is not functioning normally. So they should try to, instead of buying depression after marriage, let it be cleaned before. That is why I was mentioning pre-marriage counseling. Now, once you are married and you are completely normal, they look at a scenario where both of them are normal. Young girl of about 20 to 25, less than 30, a boy of average built-in height with normal secondary sex characters. If by consumption of their married life, 6 months to a year, they are not able to conceive, they should immediately seek information and then guidelines to why they are not conceiving. This why should be the question. Then answer of management comes later.
Exactly.
Okay, secondly, when you have a history of chronic disease before married life or during early marriage life, like for example, if she is having a chronic illness of endometriosis or ovarian cyst, or what she was operated before. That's why I told you that history is very important.
Yeah.
If she, by any chance, she was not told when whether this operation done on her was because of ovarian cyst or endometriosis or a fibroid removed before marriage. So part of the uterus is already compromised. Part of the ovarian function is already compromised. So they should seek early. Okay, and also in families where there is early menopause is there. Meaning if they have 2-3 sisters who are having early menopause and now the younger sister is getting married, she should also check her hormonal profile to know where she stands in fertility.
Yeah, of course.
The same way in a male, if there is a 2-3 brothers and in the family difficulty is there for conception, they should check themselves and come to, if they're having differences of secondary sex characters are little different, or their obesity is there, or there are certain family background of kidney disease is there. Of there are problems of hormones are there, thyroid is there. That also affects in males.
Yeah.
So that can be well managed if you know it.
Yeah, because here in the Middle East we have this problem that men are less courage to go to the doctor.
Not
and
only not only Middle East, in all over the world, it's a male egoistic society. You know, they will let the mother-in-law, the woman is taking care of the woman. Male will not bother to, still educated, literal male will not come to the clinic until they're pushed by the wife or blackmailed by the wife to come to her. Why? I'm fine, I don't have any issues. But this is the problem all over the world. So it should be, that's why we say married life is a companionship. You know, there should be friendly attitude towards each other. Recognition of the problem leads to solutions.
Absolutely.
So until you recognize the problem, you will not be, seeking advice. So advice, management, and then prevention. I would like to stress on two things which are very lifestyle, or this is modernization, a penalty of being modern that we are giving is addictions and stress. These addictions starting from smoking, then leading to shisha, and then other addictives, both in male and female. They are a most, very dangerous cause of fertility that takes time. Not only there's no U-turn to it, but also it can affect the gamete quality and inability to conceive, and then to conceive to miscarry. So all these things go hand in hand. Addiction, stress leading to addiction, addiction leading to society issues, and then getting married and not conceiving, then not ready to getting rid of those addictions. I drink only one small drink every day, or I have only 5 cigarettes per day. It's poison. Even if it's small, it's a poison. And I would take this platform as a guideline for all the people watching, my viewers today, because all the people are not scared of occupational hazards also. So where we are working, eating, sleeping, lifestyle changes altogether are different. Where are we working? What are the effects on temperature, of temperature on us, especially on males? Mobile phones, laptops. The male infertility is now being addressed very vigorously. If you don't go on the internet, they're after all these things. Radiations. Radiation not only from chemotherapy or for radiotherapy only, or for X-rays only. Radiation from television, radiation from computers, radiation from your mobiles, radiation from your laptops, and even the radiations from consistently being there in any electronic surrounding. So this is also giving you an alarming increase in fertility. That can be prevented. Where the issue of causes then goes back to prevention.
Yeah, it's only about awareness.
Yeah.
What is assisted reproduction?
The answer is in the question, because assisted reproduction means anything, any method, any guideline to assist reproduction. And it can be an assistance on the part of your changes of your lifestyle. It can be a part of your changes in your fertility knowledge. Sometimes people don't know what is the fertile period. We can assist there. But as part of assisted reproductive technology, where the scientific technology comes in, is where your natural fertilization or natural methodology to conceive is not helping you. To begin with, we assist in the production of egg formation or maturation of egg by the help of medication. That is known as ovulation induction, when we help the woman to ovulate on time. The first step. After recognition of all the basic criteria that she's ready for that. Because that we have already talked about what are the effects of these problems that are going to leading to infertility. So first thing is ovulation induction. That means we give some medication with the proper cyclicity, and then we give them a fertile period so they can try naturally if the husband is normal and the tubes are patent. We've already looked into it. And the time period for their consumption of marriage is less than a year, and rest of the things are normal. One. Secondly is when ovulation induction is not helping, so we can assist by the transfer of the gamete, that is the male sperm, into the tract, and that can be done by the preparation of the sperm, by activation of the sperm motility, by concentrating the normal sperms and letting them be available for fertilization at the right time. This is known as AIH or IUI, intrauterine insemination by husband sample, and it can be tried at least 3 times minimum with the help of ovulation induction, meaning we give medication. Sometimes we do natural cycle AIH also, but when we see that ovulation induction is not helping and naturally she's making one good egg. And then there are certain criteria to meet to go for AIH. We should have already checked the tubes, okay. There should not be any infection in the sample. There should not be any infection in the cervical factor is already, we are eliminating by the IUI. And also the screening is important, that hepatitis B, HCV, HIV has been screened out. And where AIH or IUI is helpful, also it is helpful when the husband is not around. You would ask why?
Yeah.
Because if your husband is not around, how can you get pregnant? When the husbands are working outside the area of, when the wife is living in UAE and the husband is working outside, what they can do whenever they are visiting, they can save their sperm.
Okay.
And consistently, we can use that sperm samples for IUIs, even for IVF same way.
Yeah.
So and also if they are unable to consume their marriage, that they are unable to, have relationships. Like if there is any ejaculatory disorders, if there is any spinal, diseases or spinal injuries where the husband cannot have a natural intercourse, all these people can be helped, provided they have the normal sperm sample. They can be helped by IUI only. Then comes the in vitro fertilization or IVF, as the name suggests. We are trying to fertilize the egg outside the body with the husband sample, with the husband sperm, where there is a tubal factor. That means either tube is there which is not functioning or it is blocked. Or they have been trying to conceive with all things normal, that is unexplained infertility, for more than 3 years. So IVF is done when there is a tubal factor, tubes are blocked, damaged or not functioning, or naturally they are not conceiving, or there is a problem of availability of the egg at the right time. Chronic endometriosis, all these situations are there. So once the factors of the male side comes into play, that means if you have less number of sperm, less motility, and less number of eggs as well, or age of the female, then ICSI is the answer. And we select one good sperm, and the process is the same, that we prepare the number of eggs and we take them out and try to fertilize them outside by directly injecting into the egg. The sperm is being injected, that is known as ICSI, intracytoplasmic sperm injection. And that is mostly done for the male factor infertility, but sometimes it is done for combined when the IVF is failing, age is more, previous IVF is showing not proper fertilization. Also, when we see that the persistence of abnormal fertilization is there with natural fertilization, we try to go for IVF. And also when we don't have sperm in the ejaculate, so we take surgical sperm retrievals and then we have to directly inject that into that. This is ICSI. Then PGD comes, that is when we select the good embryo genetically, and gender selection also can happen in that, and that is good chromosomally balanced embryo can be transferred at the right time.
Is there any complications, and is it available in UAE?
Of Of course, first of the, it's available. It lasts almost more than 25 to 28 years. Most centers are running very nicely in UAE. And complication-wise, yes, to every iatrogenic, any man-produced production has got complications. What to say of IVF?
Exactly.
The complications are limited because once you are in good hands and you are very, well monitored. So now with the passage of time, with the advent of good drugs and good control over the screening methodologies, we have less or least complications. So far in last 10 years, conceive has not got many complications in hand. Alhamdulillah, no OHSS record. But the complications, like any other pregnancy complications, are there. First of all, no pregnancy is also one of the complications when you don't conceive. But then ectopic pregnancy, the chances when there are, there is almost 5 to 10% chance that when we transfer an embryo, it can trickle down into the tube. That can happen. Mild stimulation to severe stimulation, meaning if you have tendency, like polycystic ovarian disease, they have a tendency to overreact to a drug which is being given to produce eggs. So they might make up more than the required number. Then it is an iatrogenic condition which is self-limiting, and it can be controlled. So it's not a life-threatening situation anymore now. And the third complication is the long-term complications the scientists are taking into account is the effect of these gonadotrophins on the joints, on the bone marrow, on early menopause. All these things are into the parameters of scientific discussions. But then if you have limited attempts and if you have limited drugs, then least of the side effects. Idiosyncrasies, sensitivities, allergies are there, but not very common, not very common at all. So we can monitor, we can assess. That's why pre-IVF or pre-ICSI screening is mandatory, which is good for you, what to select, who to select, and what to be given at what time. This is the key for the prevention of complication.
What are the chances of success?
Chances are in oneself. The person coming to seek pregnancy or to take a home baby is giving us the quality of egg, is giving us the quality of the sperm. So it is individualized. Centers now they label as take home baby percentages of different centers. But I divide them into groups, like in early 20 to 30 years of age group, the percentage is higher as compared to plus 35 group. So these chances depend on the age, chances depend upon the weight, chances depend upon the previous exposure to the drugs, and chances depend upon the quality of the chromosomal fusion of male and female, or genetically normal male and female. So higher is the age group, lower is the chance. So in most of the best centers of the world, they are claiming out 65 to 75%. For us also in conceive, we have got more than almost 59% success rate in a younger age group, and almost 40 to 45% in 35, 32 plus ladies. So then also it depends genetically younger age. See, if I look 50 but I don't behave 50, so my gametes will be more normal as compared to a girl who is 20 but who is behaving like 40.
Exactly.
So biological age is important. So two, the chances are dependent on the person and themselves, and the center providing the technology. If it is upgraded, highly skilled people consciously doing, honestly, verifying the facts and improving their chances to conception, that is the key. But 99% the abnormalities in the chromosomes are responsible for the abnormalities or inability to conceive. So that also we are now checking, and the only thing is the cost. So otherwise it would have been a better idea to select one egg and select one sperm and then select one embryo cell also, and to see which one is normal.
Doctor, is there any role in dietary of infertility?
Yes, it's a very good question. I think it's the theme of the day. Some people eat to die, some people die to eat. So it's the dietary habits which take us to metabolic and endocrine disorders. Selection of the diet is mandatory for the girls as well as for the boys. We should have least of carbohydrate and good quality proteins, more of natural and fresh fruits, and more of not to use any preserved or long-standing rested food in the fridge and like that, and avoid anything which can increase the toxification in the body. With these toxic things dating from the cold drinks to the preserved snacks, these are all bad for normal health as well. So what is normal for health is the normal for fertility as well. So basically the juices containing all the vitamins, especially antioxidants, food containing good quality proteins, so that the building blocks of the hormones and the body structures can be taken care of, and plus detoxicating foods like fresh fruits, green vegetables, sometimes the prevention of all the ill effects of the pollution also. With the passage of, with the help of diet can help us. Diet during pregnancy is also very important to maintain a good iron level, to maintain a B1, B6, B12 level. So what a cell needs to rebuild is the same what we need for pregnancy. The cell needs calcium, potassium, vitamins, B complexes. The same requirement is needed to conceive. And prevention and detoxification, the diet, especially some of the mushrooms, some of the fresh fruits, and seafood. But there are certain toxic seafoods also. There are certain fishes which are increasing in mercury poisoning, so lead poisoning. So cold drinks of any sort is lethal for the cells. So it will be long-standing chronic bad news for the gametes also. So diet always play, we take diet not only to have nutrition, to have a growth of the cells also, to maintain the prevention of the toxins coming to us. So that also a part of immunity. So immunomodulation from diet is mandatory, especially in subfertility.
What is your last message to our viewers?
Well, first of all, thank you very much for inviting me here.
Thank you.
And listening, all the viewers for listening to me. I hope the message, take-home message should be, prevention is the cure, even for subfertility. If you are taking care of the newborn, the would-be mothers, we have to take care of them. And plus the change of lifestyle, change of your diet, change of your mindset. If somebody is depressed, there's only one reason to be so fertile. So all these things, take care of your children, because they are the key for your success, because they will take your reproduction onwards. So the baby to be born, that's the time we have to take care. So be careful, mothers.
Thank you, Dr. Asma, for all of this useful information. Thank you for watching us. Good evening.